Hello guys, welcome back to my channel. In this video, I'm gonna talk about the ATI exam. So I just finished our last ATI exam today for obstetrics, OB-GYN. Yesterday we had the pediatrics exam. So we only have two ATI exams this semester. And I talked in my previous video before like about ATI exams. So for me, I didn't really I don't really expect that I would get a level 3 proficiency in ATI because it's very difficult or not very challenging. I would say if I say difficult, this kind of like misconception a bit, but very challenging because again you have to know like a ton of concepts in that specific topic, whether it's pediatrics or obstetrics, right? So you have to know a lot of concepts and be able to apply those concepts in situations with critical thinking. So I did achieve at least like level 2 on both of my exams. So I'm very happy that I would not have to retake it or remediate for that. So because I think the goal for every school is like this get like level 2, because again level 2 is just saying that you're somewhat prepared to actually pass the NCLEX in that specific category. And of course, they still recommend that you actually do more studying and keep on reviewing so that you can improve your score and be able to increase your chances of passing the NCLEX overall. So yeah, I'm just gonna share my study habits on ATI. Um, so some people actually don't have an idea or first time taking ATI and just aiming to at least pass, because again it's a combination of a lot of factors, right? Because like some people are very either they have prior experience in healthcare, because in nursing school there's some of the people who are working as a CNA, nurse assistant, PCT, or LPN, and they're just trying to get their RN or BSN, right? So they have that experience to actually boost their chances of increasing their score, because they can grasp that knowledge of that topic easier and more and retain it more. Because for me, like I've been working for engineering for over 10 years, so for me to actually get or what do you call this, remember all those concepts in those categories like obstetrics and pediatrics, it was like a lot, like I know I get the minimum idea or like the basic ones and kind of apply like how to intervene when needed, but it's still like a lot of information for just learning in a 4-month time frame. But for sure, if you are for people who actually become a nurse and then they get assigned to a unit in that specific field, they can get more proficient because they deal it with every single day. Because there's no really exact experience for every day in nursing that like even in clinicals that sometimes it's very slow, sometimes it's very fast paced, and you can't even breathe to actually like do something else, because like there's patients that actually need intervention or monitoring every 15 minutes. And so for me, again, study tip number one for ATI is just like reading the ATI book, because sometimes there's I'm not sure, because like some of you might be in nursing school, right, that there's a difference in some concepts that are being taught in lecture and ATI. So ATI tests like like some of the things like differently, or they expect a different answer whenever some concepts are example. Like I'm just gonna bring up like the difference for stages of labor, right? So there's ATI might have only like latent phase or active phase, and then some books would have like 3 stages of stage one. Example like latent phase, active phase, and transition. So there's kind of difference. So you have to like be familiar with that. And yeah, so and of course every nursing student, I think they get like a ATI textbook for that specific course. So what I did, I didn't really read all of it, to be honest. Like I read some of the the chapters in ATI book that are pertaining to our current exam, so that I can get more understanding on what's going on. But for ATI exam purposes, I did I definitely did like all the questions on every chapter, because like every chapter has like Q&A. So what I did was like read all the questions and I marked the correct answer. Either I highlighted or circle it, underline, whatever works for you. Because like for me, I it's easier for me to actually remember if I see something highlighted or circle, and I can focus on that. Of course, not just that. Like if I have more time of like remembering the correct answer, I also try to get the because every Q&A portion of every chapter, there's also like a rationale. I read the rationale of the correct answer, why it was right, or that would be, yeah, that's what I do. And then also, I try to read also the rationale for the wrong questions. But if I don't have time, example, like I feel like I feel sleepy or tired, what I do is just like whenever I try to answer questions without looking at the answers yet, I would try to answer the question right, and then if I got the answer correctly, I'm just gonna read the rationale of the correct answer, just to like, what do you call this, verify that I'm thinking the same thing. But if I answered incorrectly when I tried to answer the question on the chapter quiz, whatever, right? I look up the correct answer, the rationale, and also the choice that I made and why it was wrong. So that like the next time, like, okay, so I'm not gonna think this way because that's not how it's supposed to do, or you're not supposed to be doing that, or it's not supposed to be that way. Yeah, it's like because like I mean it helps me get trained to think a different way, because sometimes like what we think might not be the correct way or might not be the most efficient. Example, like there's going to be a prioritization question, like what would you do first, or what would be the first step, or immediate intervention, right? So some of the, if it's a multiple choice, and then sometimes like all the choices are correct, like again you have to like make sure that you understand ABC, airway, breathing, circulation, and go on that. So you check, assess for the airway first, breathing, circulation, and the other one's just gonna follow through it as a maintenance or secondary intervention, right? So yeah, so I read the ATI book, and I read all the chapters. I didn't really the chapter questions. I mean, not all the chapters, but the chapter questions for sure. And I underline or remember all the correct answers and rationale. And then I didn't read my textbook, but I read my notes. Because like I like note taking, but I'm not as, what do you call this, a very detailed note taker, because I only write the terms or concepts that um, I'm not familiar with, or that helps me understand the lecture better. So those are the things. So I opened my notes and just skimmed through it. And then yeah, and then also ATI, again there's atitesting.com, there's a dynamic quizzing. So I did went through all the questions and the on the bank. So ATI would have like an option to test without time limit, and test that answer that a test that doesn't count towards points. Yeah, so I finished all of those questions. I'm gonna read all the rationales too, and yeah, and then actually get rested the night before, and believe in yourself. Sometimes like regardless of how much you study and prepare, if you second guess yourself, you're starting to have anxiety, and then that goes downhill, and then instead of you getting focused, you get distracted or nervous. But yeah, so those are the tips that I did to be able to pass with the level 2. Again, if you're aiming for level 3 or higher, or level 3, that's the highest, then go for it, right? So as long as you prepare and actually know the material, then It's not impossible. It can be challenging, especially for some who are brand new to the nursing, so or learning nursing for the first time. Yeah, again, thank you guys for watching this video. Take care, have a nice day, good luck in your exam.